Okay, now can you hear me? Good morning. Welcome back to Georgia State. Okay, I hope you can hear me now. No? He can't hear Justin? Justin. He can't hear back. Now can you hear me? Okay, I got a thumbs up in the back. So welcome back to Georgia State. We're so glad to have all of our retirees and future retirees. I see some people that are way too young. I like Miss Jill back there. She's too young. Anyway, welcome, and we're so glad you came. I'm Beth Jones. I'm Associate VP for Finance and Administration. And today we have the people from the University System of Georgia here to talk to you about options that are going to occur with the health insurance. So I'm going to turn it over to Miriam Fredericks. She's the Vice Chancellor for Human Resources with the University System of Georgia.
Good morning, everybody. I'm actually going to do the intro, and then we're going to have Brian and Karen to do the presentation. So just to set some just information that we've been gathering over the last couple of presentations, we're meeting with all of our USG schools. So we have 30 more presentations to go. Actually, we probably have more than that, because we're going to go double to a couple of schools. So we have those presentations to go. We're collecting a lot of questions, all the questions that you all have. Please post them. Make sure you're presenting those. Do I have this too close? Make sure you're giving us those questions, and we will make sure we either have answers for you today, which I think we have pretty much every answer except for the one that we know y'all want, and that is the one around the subsidy level, and we're still working that out. We don't have our complete budget yet. So we don't have our budget numbers from the legislators finalized. We also do not have our experience yet from 2014 and 15 in order to know what our premiums could be for 2016. Karen's going to talk about this in her presentation. Just remember that that information is normally not available until August after our board meeting. And typically, we start doing that communications in September with our retirees as well as our active employees. So we probably can't push that date up very far because it depends on actual experience by the month. But we'll talk about that in some more detail as well. We have our website up for retiree benefits. So that's been up for a while. We're going to update that and try and bring it forward a little bit more on the USG website. So some of the things that we're going to talk about today, write down what you need to write down, but everything we're going over today, plus some things that are website addresses, we're going to have on the website. So if you don't capture it today, that's okay, because it's going to be on the website for you to get a little bit later on, okay? If you have any questions, again, just ask us. If we don't get them before the presentation is over, come up and let us know. Or if you want to jot them down on a piece of paper and send them to us with your address, we'll respond via address. We'll also respond via email, okay? So with that said, I'm going to step back and let Karen do our presentation. And again, just let us know. Thanks.
Okay. Oh, my mic is on. Thank you, Marion. Good morning, everybody. As Marion mentioned, my name is Karen Elliott, and my role at the University System Office is Associate Vice Chancellor for Total Rewards. And Total Rewards is everything dealing with benefits. So that's over the benefit plans for active employees and retirees. And I'm glad to be here today to talk to you about the changes for 2016. And as Marion mentioned, we'll be here and answer as many questions as we can. And anything that you want to ask us afterwards, we'll stay after as well. A couple of comments that I want to make up front is some of the questions that we've already received or concerns is about whether this is Obamacare, if it has anything to do with the Obamacare and the public exchange. So I want to say that right up front. I'm going to try to adjust this down a little bit. Okay. Can you still hear me? Oh, that's good. Okay. is that this is not the public exchange and this is not Obamacare. So what we're talking about is the private exchanges, and these have been around for several years. They've been around since 2006, and so it's very different, and I'll talk in some more detail about that as we get into the presentation. So what we're going to talk about today is I want to give you a little bit of background about why this change was made. So I'll spend some time talking about that. And then we'll talk about what is changing, what the healthcare benefit is today, and then what it's going to look like in 2016. We'll also talk about what is a retiree healthcare exchange. And we have Brian here, who's going to talk about what the Aon Healthcare Exchange is. And then we'll talk about the tools and the resources that are going to be available to you through this process. As Marion mentioned, we're speaking to all of our retiree groups. We met with UGA retirees on Friday, and we had a lot of great questions from those sessions. And all the questions that we gather from our retirees throughout these meetings in April, we'll make sure that we have all the questions posted on, I don't know, I'm getting some feedback. We'll have all those questions posted on our website, so we'll make sure we get those available to you. So let's talk a little bit about why this change was made. As you all know, if as you've come to your benefits meeting every year during open enrollment, and I see Corinne in the audience, so she's talked to you about rising healthcare costs every year. So that's something that we've been experiencing in the United States. It's not just with USG, it's an issue across the nation. I was just at a healthcare conference a couple of weeks ago, and they had leading experts talking about how we can address rising healthcare costs in the United States. So we know it's a problem and it's an issue that we're working on. One of the things that the Board of Regents had asked us to address is specifically was surrounding retiree healthcare costs, because we have to report our retiree healthcare liability on our financial statements. This liability has increased immensely over the last 5 or 6 years since we've been reporting it. Today, that liability stands at $1.8 billion. Again, it started out in the hundreds of millions, and now we're in the billions. So that was one of the things that the Board of Regents became very concerned about. In addition, if you look at our retiree healthcare costs, the increase year over year for the last year was about 25%. Okay, right now for retiree healthcare, each year it costs us $85 million. And so that was one of the things that the board was concerned about, specifically not so much about the cost of retiree healthcare, but about that rising liability and how do we reduce that rising liability. We know that it's going to continue to increase because we're going to have an increase in the number of retirees, but how do we reduce that liability from increasing so fast? So when the board asked us to look at our some of the options, at the system office, we work with a total reward steering committee. And that committee is made up of faculty and staff across the system. We have actually one of the faculty members from Georgia State is on that committee and works with us very closely. That committee looked at the number of different options available. We looked at what other employers were doing. We also work with a consultant who advises us. He has national experience, and actually he's a son of a GSU retiree, so he advises us on different options that are out in the marketplace. And so again, looking at all these different options that were available in addressing retiree costs, we looked at what other public employers were doing. And the change that we're here to talk to you about today, this was the change that was recommended by that group and was recommended to the system office. We looked at it at the system office, and it's what we took to the board because it provided the most choices and the most options and the best value for our retirees. So that's where we landed with this change. There were other options that we looked at, but we did not feel that those options were as good as what we decided today. So we'll share with you what this change is. But again, that's a little background on the change and where we came from. The board approved this change in the November 2013 meeting, and it was actually a two-step process. And the first step was that the USG plan would become secondary coverage for all Medicare eligible retirees. So we've been working on that change, and we're wrapping up that project, and again moving into the next change that's coming up for 2016. So what's changing? In today's environment, the USG plan serves as your secondary coverage. Medicare A and B is your primary coverage, and the USG plan provides that secondary coverage. In 2016, retirees will get their coverage through a retiree health care exchange. So you'll get the insurance through Aon Hewitt's retiree exchange. USG will provide you a contribution to use towards the premiums to pay for that coverage. Okay? So today, your supplemental coverage, you pay those premiums directly to USG. Those are direct debited from your account. In 2016, you will pay your premiums to the insurance company, and then you will get reimbursed from a contribution that USG gives to you. Okay? So I'm going to walk through a couple more examples just to give you a better idea of how that's going to work. One thing I wanted to make very clear, and this was very important, that the Chancellor wanted to make sure all of our retirees understood that USG remains committed to a retiree health care benefit. So that is one thing that's not going away, is that commitment and that contribution that we're going to provide to you to help pay for that insurance, okay? So again, it's different. The way that insurance is going to be provided to you is different, but that commitment is still there. So what is a retiree health exchange? It is a marketplace, if you will, where you will go out and have the opportunity to look at different options and choices. There'll be different plan options, and there'll be different carrier options, where today you've got 3 different plan options. You've got the comprehensive care plan, you've got the Consumer Choice HSA plan, which is our high deductible plan, and you've got the Kaiser HMO plan. So this is if you're Medicare enrolled. Those are your 3 plan options. In the exchange, you'll have many different plan options that you will be able to choose from. And I've heard some retirees say, I don't want any plan, I don't want to choose. I just want the plan option like I have today. And if you want something similar to what you have today, you will have a benefit advisor work with you and help you find a plan option like you have today. So they'll know what plan you're enrolled in, and they'll be able to guide you through that. One of the analogies that I'd like to use to describe the exchange is, think about in the old days, before they had Expedia and Priceline online, but think about when, in the old days, when you were getting ready to go on a trip, and you would call your travel agent, and that travel agent would help you plan that trip for you. So let's say you were going to go to Europe. You might call that travel agent and talk to that travel agent and tell them, I want to travel to Europe and I need you to help me. And they would look into, how are you going to get there? Do you want to go by plane, or do you want to go by ship? They would ask you, what kind of hotels do you want to stay in? Do you want hotels with a pool? Do you want a king bed? Do you want a queen bed? They might ask you, what do you want to do while you're on that trip? And they would help guide you and help you make those decisions. When you start making your decisions with the Retiree Health Exchange, Ann Hewitt will have benefit advisors just like that travel agent, in which you will talk to that person and they will ask you questions. They will ask you, do you travel in the United States nationally, or do you travel internationally outside of the United States? So they'll want to know if you maybe have a summer home in the north where you spend 3 months of your time, or do you have a winter home in Florida? They'll need to know that information as they're helping you decide what coverage you need. They'll also ask you about your medical conditions and your health. They'll want to know what prescriptions you're taking. So they'll want to know a lot of information about you to help guide you into the coverage that specific for you. So in today's environment, there's very few plans and it's kind of a one-size-fits-all. In the new environment, it'll be very specific to your health needs. And it may be, if you cover a spouse, your spouse may need a very different plan from you because they may have different medical needs. So each person will be able to decide on the plan specific for them. There'll be other carriers. There'll be Blue Cross Blue Shield will be an option, and Kaiser will be an option. So we made sure both of those options will be available on the exchange. But there'll be other options there as well. You might see names like Humana. There might be Aetna. So there'll be other options like that. But if what you'll want to think about and what you'll want to prepare is thinking about the doctors that you see today and making a list of who those are. Because if it's important that you have those doctors in your network, that's the information that you'll give to Aon Hewitt, the benefit advisor, and they'll make sure when they're pulling up options for you, the only options they'll pull up are plans that have those doctors in the network, okay? So it's a very interactive process, and they'll work with you as long as you need to get you the coverage that you need. Again, what it is not the public exchanges. Those were established a couple of years ago, and you may have heard some problems with enrollment and those type of things. So this change does not have anything to do with those. It's very different. This is a fully developed marketplace. There's actually 30 million retirees in the private healthcare exchange. So it's a very large group. It's tried and true. They've gone through and worked out all of those kind of issues. So again, I'm just going to walk through a visual to explain again how the exchange works and how the premiums, the payment work. So USG is contracting with Aon Hewitt to provide the exchange to all of our retirees. So this is, I want you to know, it's not something that we're going to tell you, go off on your own and do this by yourself. What we're doing is that we are working with Aon Hewitt to provide service and resources and tools to help our retirees through this process. Aon Hewitt works with all of the carriers to bring the plans to you. So they have contracted with different carriers to provide those different plan options. And then, as I mentioned, they will also provide those tools and resources to help you make the decisions. Finally, USG will give retirees the contribution or the subsidy to pay for that coverage. So once you work with Aon Hewitt to make a decision on health care coverage, then you will pay that carrier directly. So if you sign up with Humana or Blue Cross Blue Shield, whatever that carrier is, you will pay directly, your premium directly to that carrier, and then USG will put money into an account for you, and you will automatically be reimbursed for part of that premium. Now, there's many different plans out on the exchange. There's some plans that have higher value than the comprehensive care plan. So in the comprehensive care plan today, that is your secondary coverage, but if there's anything that Blue Cross Blue Shield, anything that Medicare doesn't cover, that secondary coverage provides you that. Sorry, everybody. That plan provides you that coverage. Technology is great when it works. So in this new environment, you'll be able to choose if you want a richer plan with no deductible, you will have the option to choose that type of plan. Okay, so that would, if you choose a richer plan, that will have a higher premium. If you choose, there's plans out there that you could choose with a lower benefit than the comprehensive care plan. And some of those plans have a very low premium. They might be $25 a month. And then you might have extra funds left over, which you can use to pay out of pocket. So we'll talk a little bit more about that. And I'm going to bring Brian from Aon Hewitt up to the stage. And he's going to talk a little bit more about the exchange. And hopefully, it's starting to come together. I know it's a lot to think about, but he can talk a little bit more, and then we'll talk about the process and what will be happening over the next several months.
Great. Thanks, Karen. Everybody hear me okay? Super. All right. It's a good-looking crowd out here. I was looking from on the stage. It's kind of unnerving to be up high, but at least I get to see everybody, especially there in the back. Well, again, welcome. Thanks so much for coming out today. And, you know, with a session like this, it's always great just to kind of talk about something that's new. And it is new for you folks. I mean, because you've been enrolled in group plans, and it's a change. And we're here to make sure that you can ask as many questions as you want. And I'll stay as long as Karen will let me stay afterwards, and we can certainly answer any questions that you might have. But again, just wanted to really kind of outline sort of how the individual exchange works. And Karen really hit the nail on the head in that the Medicare marketplace has been around, obviously, since the mid-'60s when Medicare started, but even more recently in the last 10 to 15 years, really with the start of the Part D, the prescription drug benefit that started with Medicare. The Medicare marketplace is very vibrant. There's many, many choices. As Karen mentioned, I think you have 3 options today. For an example, on average, retirees that work with our benefit advisors, just where they live in their zip code, will have an average of 35 medical plans to choose from and 20 drug plans. So lots of choice, lots of opportunities. But don't get overwhelmed that there's going to be too much choice. That's why you're going to have a dedicated benefit advisor to help you through that process and make the best decision for you. A little bit about Aon. We're sort of the intel inside employee benefits and healthcare, if you will. A lot of folks work with us through their employers. They just don't know our names because we're kind of the behind the scenes. We're the folks helping out between the insurance carriers and their companies. But we've been around doing this type of work with large employers such as the university system all over the country and large employers all over the country for more than 30 years. And in fact, we work with so many folks. It's an interesting stat. About 1 out of 14 Americans works with Aon through their employer or through, like we're talking about today, the retiree health exchange. So we work with a lot of folks, both active and retirees. We serve millions of retirees today and have served and enrolled more than 350,000 retirees in the same type of exchange we're going to talk about today. So we have lots of experience there. We're going to provide many, many tools to help you individually. We don't look at a retiree group as, you know, retirees are all the same. We're all individuals. Every one of us has different needs, different wants, different things we're going after. Our budgets are different, our health care is different, where we live is different. So we have all the tools, and our benefit advisors are licensed insurance, Medicare insurance experts to help you through that process. So don't worry at all, because we've got great experience of working with individuals from all over the country in all 50 states to make sure we understand their needs and get them enrolled in the right plan that works best for them. So we'll have many, many tools to help you, first of all, learn. We really feel like our number one goal is to make sure that you can make an informed decision. Nobody wants to just feel like they got in a plan and they're not sure about it. They still have some questions. So we're going to take lots and lots of time with you individually to make sure that we understand your needs and understand and answer any questions you have. Because if you can, you know, being in education, if you can make an informed decision, that's the best decision. So our number one really tenet in all of this is education and making sure folks understand their choices and are comfortable with the plans that they enroll in. All right? And as Karen mentioned, we have a broad range, and I mentioned a little bit earlier, average of 35 health plans and 20 drug plans wherever you live nationwide. We've got lots of choice and options there. She mentioned the carriers, all the national carriers. We have contracts with more than 90 insurance companies, and that gives those insurance companies have about over 3,000 different plan options. So you're going to find any sort of, you know, ice cream flavor that you want for sure, and we'll make sure that you understand that and can pick the plan that's best for you. Maybe it's a plan with a higher monthly premium, but you don't have to worry about it because whatever happens at the doctor or the pharmacy, you have very little out of pocket to pay. Or maybe you want a choice that you're going to pay a little bit less premium and kind of pay as you go. If you're fairly healthy, or you know, you go to the doctor a few times a year, you don't have any conditions that are going to be costly, maybe you want to save the money on the premium. So what's really nice and what retirees like about the exchange is they have that freedom to choose. So it's not about, you know, and the reason the university system is making the move is, you know, they can offer 3 options today, you know, which is not easy to do, and those are great benefits. But when you go to the individual exchange, there's so many different options for you to choose from, and that makes folks really happy. And to tell you about our satisfaction, we've got more than a 92% excellent satisfaction rating from our retirees. So we rate them, we go out and survey our retirees after we enroll, and on average, they're very, very positively happy with the experience. And with that experience, you'll actually get, we'll talk in a minute, you'll get your own dedicated benefit advisor. That's a Medicare expert. And we'll talk a little bit more about that. And by dedicated, I mean you'll have their direct line and extension and can work with them throughout the process when you're making a decision to enroll. And some things here too I would just point out is it's always great to sit up here and talk about how well you do things, but it's even better when somebody else has taken a look, a third party has taken a look at your organization and can say, yep, put that stamp of approval. They really do the things they say they do. And we're really excited. We have a partnership, and we're recommended by the National Council on Aging. And I'm sure many, many folks are with this audience with all the research and the educational background, do a lot of research. Feel free to go to their website, which is mymedicarematters.org. And you can read about their recommendation of the Aon Retiree Health Exchange. What they did is they came in and audited us and said, okay, we're looking for a partner. The National Council on Aging has 2 main principles, and that's financial security for seniors and also health improvement. And they were looking for a partner that they could work with to help retirees find plans that met those 2 main pillars. And we're really excited that they chose us. And part of that along with their, they have 9 standards of excellence, is making sure we're doing things like educating retirees on their options, making sure that we can offer tools for them to make sure that they can pick the right plan for them, both medical and drug plans. And they also made sure that our benefit advisors are unbiased. We're not trying to get you into a certain plan based on, how that plan works or because we really like that carrier. They wanted to make sure we were totally unbiased in those selections, and that's why they chose us. We're really excited about the NCOA partnership. Okay. So a little bit more about the benefit advisors that I promised you. They are highly, highly trained in all of the plans. They have to meet very rigorous internal requirements, but also in the insurance market, they have to be licensed in the state in which they're selling insurance. And also they have to meet carrier certifications annually. Every year, the carriers have to make sure that if Brian's going to be out there talking about a Blue Cross plan or a Kaiser plan, they make sure that each and every year I'm certified on that plan, so I am an expert on that plan. In fact, when we bring folks in, they receive more than 200 hours of training on an annual basis. So it's getting up to speed, getting ready before they handle their first retiree, more than 200 hours of training. So they are truly Medicare experts. We'll be able to walk through any information about Medicare. How does it work? I've heard about Medicare A and B. Well, and Medicare D, what happened to C? They can answer those questions. Where is Medicare Part C? So they can answer all those questions. And like I said, experienced in Medicare. So that's all these folks do. They aren't talking to people about car insurance or talking to other folks about other types of insurance, just Medicare-related insurance. That's all they do. Okay, and they will be dedicated to you. You will have an advisor. They will give you their name and their direct extension. So when you talk with them, if you ever want to call them back, you can do that throughout the process. So it's not, a typical sort of call center where you're calling in and the next person on the line. They're actually going to call you when your appointment time comes up, and we'll talk some more about that. And as I mentioned, they are dedicated to you throughout that entire process. And as I mentioned too, the National Council on Aging did certify, and our number one thing after education is making sure that we're never trying to steer a retiree into a certain type of plan. We totally leave that up to you in your situation. Okay. All right, so we really want to be able to serve you when you want to be served and how you want to be served. So as I mentioned, we have all kinds of tools that are available through your benefit advisor, through the telephone. The vast majority of our folks, our retirees, when they call in, are completing the process over the phone, okay? So, but many, many folks will want to go online themselves and look at the plans, maybe just sort of kick the tires a little bit. What's available? That's kind of neat. I can put in my zip code and get a return of all the plans that are available to me just to start making some decisions. So, as you can imagine, working with millions of retirees over the years, we deal with engineers who probably already have a spreadsheet already done, and professors, very rigorous in their research and attention to detail, all the way to some retirees just, we call them help me please retirees, because they're just kind of lost and don't even know where to start. So we're happy to serve anywhere within that spectrum to make sure you can get your questions answered. So via the web and online, our website is available 24/7 to go out there. And what will happen is as soon as the university system announces the change, you'll get a packet in the mail, and the website will be ready to go at that time, as well as our phone number. We'll have a hotline specifically for you folks to call in, and you'll have the name of your benefit advisor. So from day one, once you get that information, those folks will have been trained about Georgia State and the benefits that you have today, and what your choices are into the Medicare exchange, so they're going to know something about you. And really, our benefit advisors are trained, in listening skills, being a good listener. That's probably number one, because we want to find out about you. What you're really healthy, and maybe you're a marathoner, or maybe last year you had to get that knee replaced or hip replacement. We really, through those conversations, really get to know you as an individual so we can help you better. So we'll know already a little bit about you, certainly the plans that you're in today, and our benefit advisors are going to call you, okay? So you don't have to call in and wait on hold until the next person gets on the line and they don't know anything about you. We're going to pre-schedule an appointment, and during that appointment time, our benefit advisor will give you a call. So you can have everything ready, and we'll help you kind of get set with things you need to have available, you know, your prescriptions, as Karen mentioned, your doctors, maybe even what hospitals you go to. We'll also make sure that you're aligned with a benefit advisor that, let's say you live here, you know, part of the year, but then you go down to Florida or you go to Arizona for a few months of the year. We'll make sure that advisor that's dedicated to you is licensed in both places. Okay, so they need to be licensed in multiple states to be able to serve you if you're, you know, living in one place and then go somewhere else when it gets cold, although it probably didn't get that cold here in Atlanta. But still, 80 degrees in January would be better than 40 or 50. And throughout that process online, everything that you can do online on the website is also available through your benefit advisor. So you don't lose anything if, you know, my dad is 85 years old. He's never owned a computer. He's not going to have a computer. But he trades stocks. He watches CNBC from morning till night every day. But he's not a computer person. But he wouldn't miss out in this scenario because everything that we would offer for folks online, your benefit advisor, that Medicare expert, has exactly those same tools to help you with over the phone. Okay? And we can also communicate with you whatever your preference is. Say you want an email, or say you just want to be communicated via the phone. We'll have that information, and we track all of that information. So if you were to call in and let's say your benefit advisor was on, you know, vacation or was sick that day, we have all the information in our system, so you don't have to start over. You know, your benefit advisor is going to be there, make notes of all the information that you talked about. So whenever you call back in, if that person's not available, you can leave a voicemail. But if you talk to somebody else on our team, they're going to know that information about you. You wouldn't have to start from scratch. But all that information will be available. You can look at different plans. You can put medications in, or you could change, you know, what medications you're on. You can put in the doctors that you use. And again, all those searching and all those tools really help you make some decisions. So feel free, once the website's up, to go out there and you can kick the tires and find out what works best for you. We handle really everything, as I mentioned. You can do everything up until the actual enrollment process via the web. What we do, which I think is a great sort of safety net, is the plans and Medicare does require a telephonic signature or a voice signature. So I could do everything, but it's kind of nice. Like, I know it's tax time, and if anybody's used TurboTax before, you know, sometimes you get to the end and you're feeling pretty good, and right before you hit send, you ever notice they'll have a pop-up that says, hey, Brian, would you like to pay another $50 to get a CPA to look over this or have an expert look over this for you before you turn it into the government? And I've sat there and thought, wow, I really probably, you know, I have a couple questions I might want to ask right before I press send. With us, you always have that opportunity. So you could do, you know, 99% of the process there, but you're always going to have that opportunity right at the end to talk to your benefit advisor and say, hey, you know, Brian, I think this plan looks pretty good for me, but can you take a look and make sure? And like I said, we can enroll you then via a telephonic signature and say, yes, Brian Heiler, I do want to enroll in this plan. Everything's done electronically to the carriers, okay? So there's no paper involved unless you say, I want to see some paper because I want to share it with my daughter or a family member or a friend. I would also add there, too, that our benefit advisors are very, very open to those situations. If you have an adult child, another family member, or even somebody like a power of attorney, some folks may be in nursing homes, things like that, we'll encourage those discussions to, you know, three-way call. We'll have conference calls to get them involved with you to help you in those discussions. Because again, our number one goal is making sure that you're educated and can make an informed decision. So we absolutely encourage other folks like that to be involved in the process, and we'll set up and facilitate that any time. And that benefit advisor, again, that licensed Medicare expert, is going to guide you through the process. So don't ever feel like you're alone, because you never are. You've always got that benefit advisor to help you out. And I've sat with them and listened to them on calls. They do a super job. They are not, number one, as I said, the NCOA came in and certified this. We do not incent them to finish up that call in one call. We aren't expecting that at all. In fact, we encourage them to have multiple calls. If there is any at all concern on your part, I'm not sure, I want to share it with my daughter or my son or my neighbor, totally fine. We do not expect you to make a decision in one call. Calls can last 90 minutes or more. They're scheduled for those types of long phone calls. And if your spouse is also covered, we'll handle that during the same phone call. We'll talk to you and your spouse during that time. Two different decisions. You're going to roll each, and you could pick and choose different plans, but we're going to have those conversations with both of you at the same time. So as many calls as it takes, we are not setting them up to say you do this in one call or two calls. As many times as you need to talk to us to make that decision, again, to make the right plan choice for you, is totally fine with our folks. As I mentioned, you're going to work with that same benefit advisor throughout the process and when you get enrolled. And when you get enrolled, your coverage would start January the 1st. It doesn't end there. We're always there for support. You're going to have questions about, hey, how does the HRA work? I need to file a claim. How do those things work? We're always there for you to get those answered. So we don't look at it as once you're enrolled, we're done. Not at all. We're there for you whenever and however you need us. And that's really what we do, is we really act as an agent, if you will. Okay? So we work on your behalf to make sure you get enrolled with whatever carrier that works best for you. So like I said, we're always there for you. We don't go away after you enroll. You can call us at any time and even have your dedicated benefit advisor's phone number. You can get in touch with them anytime, even after you finish the enrollment. As I mentioned, you're going to work with that same enrollment benefits advisor. All the enrollments are going to be completed via telephonic signature. Like I said, in a really unusual situation, if somebody's in a nursing home, they have to have paper. We can absolutely help out with that. To do that, but the vast majority are all handled with that telephonic signature and handled electronically. So everything goes to the carrier very quickly. The carriers get your information quickly. And the best part about that is you get your cards quickly. You get your ID cards very fast as well. And we track that process all the way through and have full visibility to those enrollments, and we can see what's going on. Okay? Pre-filled application, again, everything comes through in we'll get a file with your information from the university system, so you aren't starting from scratch with anything. If you go online yourself and actually end up going up through the enrollment application process, everything's going to be pre-filled with all that information you have, so there's not a lot of typing or input. Our website's really easy to use. We do focus groups with retirees to make sure, where we can use icons, a lot of white space, not too much typing or writing. It's just give me the basic messages and help me get through the website. So we really designed it with retirees in mind, so it's really easy to navigate if you go out there. And again, we can handle paper if that's what you need. And then telephonic or online enrollments, again, you're going to get your ID cards very quickly in that process because everything is electronic. I think that's it. Okay. Thanks, folks. Like I said, we'll be here for answer any questions that you have.
Okay, test. I'm going to go ahead and try this, and maybe this microphone won't have so much feedback. So I've got, I want to talk a little bit about the process and the timing, and then we will open it up for questions. So as we talked about in April, we are meeting with all of our retiree groups at all of our institutions and talking about the change. We'll be collecting questions during this time. And so that's what will happen in April. In May, we will be mailing a transition guide to all of our Medicare eligible retirees. In that guide, you will get information about the exchange, a lot of the information that Brian covered today, telling you what you can expect during the enrollment process, the information that you'll need to gather. It will talk about the timing of when it will occur, those type of things. In this transition guide, you'll also have a phone number for Aon Hewitt. If you have some initial questions, you can go ahead and call them. They'll be available to talk to you. We will also have a dedicated website with tools and resources available for you in May. So in that transition guide, we'll have a website address, and again, it'll be a site that's dedicated for all of our USG retirees where you can go out, get information. During the summer, we'll be posting different information. We'll have some videos, enrollment videos to talk about what that process will be like in the fall. Also in May through June, we will be meeting with our retiree advisors. And I'm going to ask, we're asking during all of our meetings for any retirees that want to volunteer to be an advisor to our office, that we would love to have you. Just see us after the meeting. These advisors will be involved in reviewing some of the communications before they're mailed to all of our retirees, and they'll get a firsthand look at what that enrollment process is. So they'll work with Aon Hewitt, and they'll talk to a benefit advisor and kind of do a, it'll be like a pilot group, so they'll try out what that process is, and they'll be able to provide feedback to let us know what questions they have, and so we make sure that we get those, that inside of our communications to all of our retirees. So if that's something that you think you'd be interested in, providing some of that feedback to the system office, we would love to have you. So just let us know after the meeting. So we'll be working with those retiree advisors during May and June. And then in August, you will need to be on the lookout for either a flyer or postcard in the mail. And that will have information about meetings in September. So during the month of September, we will be meeting with all of our retirees, again, similar to today's meeting. And during that meeting, we will have an Aon Hewitt licensed agent talking to all of our retirees about the enrollment process. So this will be much more detailed information. You've gotten a lot of information today, but again, more detailed into how the enrollment process will work, making sure that you all feel comfortable with that process. So be on the lookout for that. Also during September, we will be mailing the enrollment packet to you. So you will get that enrollment packet in the mail. In that packet will be your appointment time. Like Brian talked about, every retiree will have their own appointment with a benefit advisor. In that packet, it will have your appointment time. If that appointment time is not good for you, you can change that appointment time. So you'll just need to give Aon Hewitt a call and either confirm that time or tell them that you would like to schedule another appointment time. So they will talk with each and every retiree. Finally, the open enrollment process this year will be October 1st through December 31st. So you've got a much longer period to enroll. Normal open enrollment has been 2 weeks, 2 or 3 weeks in the past, and so this is a much longer period, so you have plenty of time to work with that benefit advisor to make those decisions. When we were talking on Friday with Aon Hewitt, they said that all of those appointments will be done during the early part of the enrollment period to make sure that you feel comfortable, so October and November. By mid-November, Thanksgiving, everybody will have had the opportunity to talk with their benefit advisor to make sure that you can talk with others, pull in whoever you need to pull in, so you have plenty of time to make those decisions throughout those 3 months. So that's the timing of the enrollment. Before we get into questions, I did want to cover a couple of things that we had questions about in previous meetings. We had some questions about the dental insurance and life insurance and vision. So those coverages will remain the same as they are today. So if you have dental coverage or vision through Georgia State, that will continue into 2016. You can continue that coverage, and you'll continue to pay your premium as you do today. The life insurance, that's the same thing right now. Retirees from the university system have $25,000 in life insurance that's paid by GSU, so that will continue. And if you have supplemental coverage or spouse coverage, that will continue as well. The other question that we had is retirees were asking, I'm Medicare, if I'm the retiree and I'm Medicare eligible, but my spouse is not Medicare eligible, what will happen with them? In that situation where you have one person who is Medicare eligible and the other is not, the covered member that is not Medicare eligible will stay in the USG plans. Okay, and the person, either the retiree or spouse who is Medicare eligible, will move into the retiree exchange. We also know some of our retirees have some dependent children that are still covered under the plan, and those dependent children will stay in the USG plans. Okay, so if they're not Medicare eligible, that's where they will stay. I believe that is everything, and right now we are all here to answer your questions, and so we'll be happy to stay as long as you like. Stu. Yes, sir.
For those of us who stayed on Blue Cross Blue Shield past Medicare Part B eligibility, can you just briefly go over how the penalty is going to be handled for those of us who did that?
Okay, I believe the question is about Medicare Part B for those that retired and did not enroll in Medicare Part B and how the penalty is going to work. Okay, so we know that some of our retirees at the time that they retired, we did not have a requirement that they enroll in Medicare Part B. And so the first part I'd mentioned before, this was a two-stage decision. The first stage was that those retirees that were not enrolled in Medicare Part B, that they enroll in Medicare Part B. And that USG, if they enrolled during the special enrollment period from January 1st through March 31st of 2015, if they enrolled during that time, USG would pay the Medicare Part B penalties for them. We are working, our office is working directly with CMS to pay those penalties on your behalf, so they should not come out of your Social Security check. Yep. Okay. I'll just, if you just want to go ahead, yep, go ahead.
I have a question of the representative from Aon Hewitt and also from USG. I understand, as you said earlier, that the subsidy will generate from USG. I also found a really helpful PowerPoint that Aon Hewitt has put online that shows the step process. And in that visual, it shows that the sponsor, USG, provides that money to Aon Hewitt in the HRA account. Mm-hmm. And it also says that the amount of the subsidy will be determined by Aon Hewitt. It will either be the same or lower. Could you tell us a little bit more information on how the HRA is determined for each individual and how that is managed? Is that managed by Hewitt or is it managed by the individual carrier?
Okay, do you want me to?
Do you want to take the
I'll go ahead and
subsidy
start.
itself, and then I can
Right.
tell how we administer it?
Okay, so I want to make sure that USG determines what that contribution will be to the HRA. And that will be done, I believe Marion mentioned, that will be done every year, just like we do today. So there's a lot of factors that go into that decision. Part of that is looking at the budget that we have every year. So as she had mentioned, the legislature had just ended, and so we're in that process right now. That process happens every year just as it has done in the past. So we look at our budget and we look at our experience, our previous year's experience, and determine what that contribution will be. So that process will continue as we have done in the past. Normally in the past, we have shared those cost increases between employees and USG. So some of those costs, employees you see as increases in premiums, and then some of that increase USG covers. So that process will happen every year like it does today. So
And-
USG will put forth a recommendation to our Board of Regents, and that happens in usually the August and September timeframe. And so that's when that contribution to the HRA will be determined. Once that recommendation goes forward and the board approves, we will have that information. Yeah, so that would be the same amount for each retiree, whatever that amount is. Each retiree will get that amount, and then you are able to decide which plan you want to enroll in. Some plans will have higher premiums, some plans will have lower premiums. So in some cases, that contribution amount may cover the entire premium depending on the plan that you choose. Although if you choose a very rich plan, a plan richer than what you have today, then that contribution may not cover that entire premium, just like you contribute some towards the premium like you do today.
Karen,
And as far as just to let you know how we administer, absolutely, the university system will let us know on a file, what that HRA subsidy amount is. Then we have our administration, that's all done in-house within Aon Hewitt. We have a unit that will administer the HRA. Your benefit advisor can answer, basic questions about that as well. Obviously, they're trained on the HRA and how you use the subsidy. Generally, what happens is it's a really neat process. We call it an auto reimbursement. As Karen says, you pick whatever plan or plans you want, as far as medical and drug coverage. Then what we do is we get files back from the carriers as well on a monthly basis. So once we know what your premiums are, the plans that you've enrolled with, we can just automatically, working with the university system, reimburse you for those premiums on about the 5th of every month is when we do that, just so that way okay, my premium, I'm going to get reimbursed for the premiums on my coverages, and you know what time of the month that is. It's about the 5th of every month. Direct deposit it for you in a bank account, write you a check, however that works best for you. But we just, based on that subsidy amount, that's what Karen was mentioning. When you get the letter, introducing your benefit advisor and your appointment time, it'll also have information about that HRA, and absolutely your benefit advisor can help you with that as well.
Karen, I just wanted to interject one thing back here. When people ask questions, we have 2 ambassadors with microphones, and we're trying to record this for other people. So please use a microphone when you ask the questions. We appreciate it.
And the follow-up question was, when is the timing that you're going to receive the contribution amount? That will be in the enrollment packet that you receive in September. Just keep your hand up high.
I have a follow-up question to the reimbursement on the subsidy. For a period of time, it was not necessary to enroll in Medicare B in order to have the same premium as people who were enrolled. At some point, that changed. At that point, we enrolled in Medicare B and were charged a penalty. But it was before the time that you say people are going to get reimbursement. Do we get any reimbursement for that penalty?
At the time the decision was approved, it was for those retirees that were not enrolled in Medicare at that time. So it only covered that group of retirees that enrolled during the January through March 2015 period.
So those of us who paid attention and did it before have to keep paying our own penalty.
Yes, yes, that is the case.
Okay.
Correct, that you will have.
Oh, sorry.
I actually have two questions, and you partly answered one of them. The premium, we'll pay the premium, and then we'll get reimbursed. Because I know sometimes with the Aon and some employers, it can be as much as 2-3 weeks before the reimbursement comes through after you pay the premium. Is that the timing we're looking at, or are we looking at within 24 hours that we get reimbursed? Or how is that planning to work?
Right. The carriers, kind of when your premium is due, usually most of the carriers want it paid either before the month starts or usually within those first few days of the month.
Right.
So we'll get that file from, all the carriers send us files, payment files, and so if you're on that payment file for that previous month, so let's say it's now, February of 2016, next year. If you paid your premium for February, as long as you paid your premium typically by the end of the month is usually when the carriers are going to send it to us. Once we see that's on that file, that 5th of the month, we're going to go ahead and just reimburse everybody who was on that carrier file for the previous month of having their payment come in. You're going to get it on the 5th of the month. And typically what we'll even do is, because sometimes, let's say, you sent it in the mail this month and it just took a little longer to get there. Really what we do is once we see that you're enrolled in that plan and have paid for, say, the month of February, just kind of get you started, that first month may take a little bit longer, may take an extra couple weeks to get that reimbursement just because we're processing all those new files. But once we see that you're enrolled in a paid premiums that first time, we auto reimburse on those. So if your check was maybe, like I said, you put it in the mail and it took a little longer to get there, you don't have to worry about it because that auto reimbursement is going to make sure that you're going to get reimbursed for those premium amounts, like I said, on the 5th of every month.
So you're saying like if we pay the February premium on February 1st, that we'll get reimbursed on February 5th?
You will, yes, ma'am. Yep,
Okay.
that's
So
how it
it's
works.
only
And
like
really
5
what we
days.
do is, we're assuming that, folks, especially in Medicare plans, once I'm set up on my plan, I'm paying that premium, right?
It's
And
automatically deducted.
Exactly. And we'll audit it like later in the year, and if we see that there was some issue where you just stopped paying your premium, we'd settle up with you. But once you're enrolled in there, it's just like clockwork, the 5th of every month.
Because I know on some companies that y'all have, it's 3 weeks.
Right. No,
and
it's very, and like I said, the premium is very quick. And so once that's set up, that January payment may take a little longer just because it's the first time it's getting set up. But after that, it really runs like clockwork on the 5th of every month.
Okay, and y'all talked about that, like Blue Cross Blue Shield will only pay what Medicare covers, will only cover what Medicare covers, but then there's some doctors that will opt out for Medicare that you can manually submit the claim. Is that still going to be, because there's a lot of doctors that opt out from Medicare, and that number's increasing.
Yeah, this was a question that actually came up on Friday when we were talking with some of the UGA retirees. Some of them live in Atlanta metro area, and they were saying that it was an issue in the Atlanta metro area. And my understanding when we were talking with Andy is that there's 2 different types of plans that you can choose on the exchange. There's Medigap type plans, and then there's Medicare Advantage type plans. And my understanding is that if you're looking for kind of specific doctors that are not accepting Medicare, then there's specific plans, the Medicare Advantage plans would be an option that you would choose out on the exchange, which would provide that in-network coverage for those providers, some of those providers. I just want to make sure.
Yeah.
Okay.
That is. And it would actually be Medigap or Medicare supplements. Really, you've always got Medicare A and B, and then you can purchase, as far as your medical options go, you can purchase a Medicare supplement, or Medigap, sometimes people call them. They're the exact same thing. And those are traditional individual insurance plans that pay what Medicare doesn't. So those Medicare supplement or Medigap plans, depending on which one, those are the ones that follow the letters, like Plan F or Plan C. That you probably heard maybe friends or family that are enrolled in those types of plans. And there are those types of plans that can pay for doctors who aren't enrolled through Medicare. If they aren't enrolled through Medicare, to your point, ma'am, you're right. Medicare Part B actually pays for the doctors. Unless they're contracted with Medicare, they would pay. Some of those supplement plans can pick up some of those costs.
Am I correct that you will enroll in a medical plan and a drug plan? And how long is that commitment? Will we have an open enrollment every year?
Yes, ma'am, absolutely. Your choices are when you come into the Medicare market, you can purchase a standalone medical plan. Those are typically the Medicare supplements or the Medigap plan that you may be familiar with. And then that would be your medical, and then you would enroll in a Part D or a prescription drug plan. Sometimes you'll hear them referred to as PDP, prescription drug plan, or Part D. That's actually Part D of Medicare. And that would be that scenario. You can also, through Medicare Advantage plans, which Medicare Advantage plans are very, very popular. I think we're now up to close to 30% of all Medicare beneficiaries or enrollees are in Medicare Advantage plans. And typically those have medical and drug combined. So you would get your medical coverage and your Part D or PDP coverage just in one enrollment. So you just have one card that does everything. So absolutely, and that's totally up to you. Whichever you find is more efficient and a better choice for you. Just to give you a sense, Medicare Advantage is really neat because you can, let's say you're a healthy person and you're hiking and, you go to the doctor just, maybe once or twice a year, you go for your preventive checkups. You can enroll in Medicare Advantage plans that are available in different parts, and I think Atlanta has Medicare Advantage plans that have a zero premium, believe it or not. You wouldn't pay anything additional other than your Part B premium, which you always have to pay Part B that helps fund Medicare. But Medicare Advantage plans, in some areas, zero monthly premium gets you both medical and drug coverage. And then you could also pay for more of a Plan F Medicare supplement plan that's kind of that buy it and forget it type of medical plan, in that you're going to pay a higher premium, but there's really no cost sharing when you use the plan. So you absolutely, you can have a single medical and drug enrollment, or through Medicare Advantage, you could have a plan that does both in one plan.
Yes, sir.
Yes. Medicare regulations defines the plan we now have as an employer-provided plan, and defines it specifically as not a Medicare supplement plan. That's extraordinarily important because it is illegal to have more than one Medicare supplement plans. I'm one of those that has all three. So how will this plan be defined under Medicare regulations? And will it, if it is defined as a Medicare supplement plan, those of us who have three will be terribly disadvantaged.
Now, when you say you have three today, help me
Yes.
with that. You have...
The Medicare regulation says that employer-provided plans will pay second after Medicare. Mm-hmm. Any Medicare supplement, the legal definition of their legal definition, will pay third. Mm-hmm. So you have a triad of payment schedules.
Right.
And that is managed along the way.
Right.
And as our health care benefits have been dropping, many of us who are sicker than others need this additional coverage.
Right.
So,
have an answer to that. So when the university system is going to end the group plan at the end of this year, so that middle part that you've got today, you've got Medicare A and B, then you've got the group plan, and then if you have purchased a Medicare supplement, what happens in that transition is when the group plan ends, it allows folks to to guarantee issue to go to the marketplace. If you want to keep the Medicare supplement you have today, that's totally fine. You'll need to get a prescription drug plan, but what it does is it gives guarantee issue to go out to the market and buy individual plans.
I can only keep it if Medicare defines the plans you're offering to us as employer provided. Have you checked with them to see how they will define it?
Right, it's not these are not employer plans, they're all individual plans.
I don't mean employer plans. There's
Right.
a definition of employer provided. This is a
Right.
legal question, legal being a term from the Medicare regulations
Right.
that I'm asking about.
Yes, sir, these are not group plans that we sell, that we enroll you into. They are individual plans, so they are by definition not group plans.
That's not really responsive to my question. And can someone get an answer to that?
I'd be
Yeah.
more than happy to, if you want to get together afterwards, I'd be more than happy to make sure I'm understanding it.
To follow up on what this young lady said a few moments ago, do you know of another plan in your, that will become the primary payer in the case where doctors choose not to participate in Medicare programs? I do not. But right now, my Blue Cross Blue Shield policy becomes primary with a letter from the doctors that say, we do not participate in the Medicare program. And they become primary at that point, Blue Cross Blue Shield.
Right, because
If that
that's
is-
the
if
group
that-
plan.
If
Right,
that is removed from us, it's a
Correct.
tremendous disadvantage.
right.
And again, that has been slowly evolving as well, where our plan beginning January 1st, 2015 will be secondary coverage to Medicare. And as part of that process, the plan is looking at Medicare as your primary coverage. So I know in the past there's been exceptions made where if you had a physician or a provider that you were seeing, but it has been going forward that Medicare would have to be your primary and that the doctors would have to be enrolled in Medicare. So that's kind of been slowly evolving anyways, but there will be some options once we move into the new environment where there'll be some plans that will address that coverage. And we can certainly follow up on that question as well.
Okay, I have a question right here.
Okay, sorry.
My concern, I'm a little not clear on some things. I'm one of those persons that do not have any medical issues, serious medical issues. Therefore, I have Kaiser. But the problem with Kaiser is you don't have a regular doctor. They may go out at any time. The challenge for me is trying to make a decision. Should I come out? I do like Kaiser, and I've had it for a long time. If I come out and I go with another carrier, will they accept new members? That is another question that they're saying I don't accept new members right now. So I'm left, what will I do if that is the case? Now, that's just one question. And I also have a question regarding the subsidized premium. Is it taxable?
Okay. So do you want to go ahead?
If you want me
and
to do
start?
the provider question, I'll
Okay.
do that. And if
Okay.
you want to do the
Okay.
taxable.
Okay.
That's a very important thing to consider if, for example, in your situation, if you were to leave the Kaiser plan, which, as you mentioned there, anytime you're going to change your doctor, your family doctor, or a specialist, you'd always want to just double check with them that they're accepting new patients. Some of them just have so many patients, they're not accepting new ones. So absolutely, you always would want to check that. Quick call to the doctor's office, just say, I heard a lot about Dr. Smith, I heard he's great. Is he or she accepting new patients? So that's a scenario anytime you're changing your physician. And then what we can do is your benefit advisor can do is work with you to make sure that doctor that say it's a new physician, is making sure that they're in the networks. But, like I said, many times the directories or the provider lists of the physicians will let you know if they're accepting new patients or not. But absolutely, we would work with you to make sure that if you are changing doctors, that making sure, number one, they're in the network, if you're looking for a network plan. And then number two, that they're accepting new patients. We'd work with you to help you with that.
And Kaiser will be an option in 2016 on the exchange, so you can look at that option, talk with your benefit advisor, and kind of talk through, you know, how you've been utilizing Kaiser and looking at other plan options too to see if something else might fit you better. So that'll be part of the advisement session. As far as that contribution, USG's contribution into the HRA, that will not be taxable to you. So I think that was the second part of your question, so.
All right, I have a question that you may have already covered, but I think you were talking about two different things at the same time, or I hope you were.
Okay.
You were talking about the HRA subsidy, which you said will be determined after the budget is made.
Right, so yes,
right.
we are looking at those numbers right now, so that's part of our normal process when we're looking at the experience from last year and projecting out the costs for this year. We're also looking at trends in healthcare, what that increase is looking at for the coming year, and then we're also working with the budget that the legislature has approved for fiscal year 2016. So that's the process we're in right now.
Now, the other thing you were talking about is the reimbursement for the Social Security penalties for late enrollment.
Yes.
I was told that those were going to be paid by the university system. Are these two different things that we're talking about? The HRA subsidy and the reimbursement?
Yes, those are two different things. So the HRA, that is the contribution that USG makes to all retirees as part of their benefit. That will begin in 2016. And so that's what we're determining right now, which will be approved by the board in August. The other piece was something that was approved and that we've been working on as well. And if you were a retiree, we had about 800 or 900 retirees out of our 17,000 retirees that were Medicare eligible that were not enrolled in Medicare Part B. So that was one of the changes that the board made, was to make our plan secondary coverage for Medicare eligible retirees. That is going into effect July 1st, 2015, where the USG plan will be secondary only. So if you were part of that grandfathered group, there was, like I said, about 800 or 900 grandfathered retirees, and that's across the system, not just at GSU. We've been contacting those retirees and assisting them with getting enrolled in Medicare Part B during the enrollment period, which was January 1st through March 31st. So they have that primary coverage through Medicare. If you're a retiree in that group enrolled during that period, USG made the commitment to pay for those penalties.
So you'll be fully reimbursed for that, or you'll pay the penalties
Just for the
directly?
penalties, just for the penalties.
Will you pay that directly, or will
We will be paying that directly, yes.
Thank you.
Uh-huh.
I think you answered this question earlier, but I just want to make sure I understood you correctly, and that is that the amount of the subsidy that's going into the HRA is a fixed amount per retiree, right? It's the same amount for everybody, no matter which plan you choose. Is that correct?
That is correct,
And
yes.
then if it's a retiree and a spouse, it would be double that amount?
We don't know, we haven't made that decision yet, so that's something we will be considering, but each individual, so if you cover your spouse as well, the retiree will get a contribution amount and the spouse will get a contribution as well into, if they're both Medicare eligible, into their a separate HRA. They may choose a different plan than the retiree, so each of them will get an amount to use towards that premium.
Okay, thank you.
Uh-huh. Yes.
A basic question. Those of us who are not retired yet, what's the impact of all this on us? And secondly, how much flexibility do we have in the transition? For instance, I run a large grant for the National Science Foundation that I feel morally obliged to administer. That will determine when I retire, which presumably is sometime in 2016.
Okay. I think I heard part of that, but the question was for active employees, if you're still actively working, this change will not impact you until you retire. At the time that you retire, if you're Medicare eligible, that's when you will go through the enrollment process.
So the status quo is maintained for the,
For active employees, yes, correct.
okay. And what about the flexibility issue?
Okay, and I missed that last part, the flexibility,
Well, I don't know exactly when in 2016 I'm going to retire.
okay?
You know, and it's complicated.
Right.
Especially with the teachers' retirement system of Georgia and all that stuff.
Uh-huh.
What I can do, what I can't do, but this doesn't affect you, but,
This won't impact you, so whenever you retire, you know, the contribution, whatever that amount has been decided for 2016, that amount will be prorated based on the month in which you will retire. So we can work, the benefit office can work with you to help you determine when would be, you know, the best time for you to retire, but that won't impact, you know, your enrollment in the exchange, if that makes sense.
So we're not constrained by the open enrollment period then?
No,
I see.
no.
Okay, thank you.
My question is, so as an employee in the university system, when you got your health care insurance, it ignored any pre-existing conditions. And now that the Affordable Care Act was approved, pre-existing conditions are also ignored in the public exchanges. But should things change for the Affordable Care Act, and now that we're going to a private exchange, will the university system continue that in this private exchange, that they continue to ignore, because people will change providers, or maybe a provider will drop out of the private exchange and you'll be required to change providers, whereas when we were with the USG system, we sort of were covered on that pre-existing condition thing. Do you know?
Yeah, good question. Do you want to start
Sure.
on that, Brian?
Yeah, when you leave as a covered either active or retiree, when you leave your group plan, that's when you and you're eligible for Medicare. You have a guarantee issue, so there aren't any pre-existing conditions when you're leaving your group plan and coming to the individual exchange. Okay, and that's outside of the ACA was really for the under 65 market. If I was, for example, if I didn't have group coverage and I retired and I went ahead and just took Medicare A and B and never bought, you know, Medicare supplement or anything, I just kind of took my chances. There are still underwriting that can go on in that post-65 market, typically for Medicare supplement plans. Medicare Advantage and Medicare Part D, because they're run by Medicare, by CMS, there's never been underwriting for those plans, so you can always get in those. But Medicare supplement plans, which have been around since Medicare's been around, because they pick up what Medicare doesn't, those plans are traditional insurance plans, and they can underwrite if you've had more than a 63-day break in coverage. But in your scenario, coming from the group plan to the individual plan, Medicare allows, and Medicare supplement plans have to abide by that guarantee issue for that period when you're going from a group plan to an individual plan. Okay? So everybody would have no pre-existing and guarantee issue when they're moving from the group to the individual market.
I have a question to USG. Why are you dumping retirees? That's the question. If it is more economical for retirees, would it be also more economical for employees? This is all technicalities for me, but you are talking about, I think you are trying to just distract us from reality. Reality is that you are dragging us through thicket of things, and we don't even know whether we will have the same benefits that we earned working 40 years at Georgia State University or USG. Please answer if it is reversible or not reversible, and who is making this decision.
I really appreciate that question because there was one thing that I did forget to mention when we were talking about this exchange, that we definitely don't want you to feel like we're dumping you or that you're not going to be part of us anymore. The HR office at GSU is still going to be here to support you. If you want to call them, if you have any questions, concerns, that's why we wanted to make sure that you knew that we are contracting directly with Aon Hewitt. There's specific requirements and service and tools and resources that we have partnered with them to provide to all of our retirees. So this is not just we're moving you out to, the exchange, go get your own insurance. There are specific plans that are going to be that you're going to have the availability to that are not out on the Aon exchange just for any individual person to go out to. So we are working closely with Aon to provide this service to you. And again, your HR office is going to be with you every step of the way. We are going to be here with you every step of the way. If we're not meeting your needs, I want you to make sure that you reach out to me. Marion's here, Monica, and like I said, your HR team as well. So the decision was made because the Board of Regents, as I mentioned before, when we were looking at rising costs and the rising retiree liability, they asked us to look at this and address the issue. When our committee, our advisory committee, our consultants that we work with, the expertise, when we looked at the number of different options available to us, there were other options out there. There were other changes that we could make. So no change wasn't an option, but there were other options we were looking at. We didn't feel like they provided the same value that this exchange would provide. So we really, in the best interest of our retirees, of our soon-to-be retirees, even us, when we're looking at, we all want that benefit when we retire. So we were looking at what is going to be the best value, providing the best service and resources to our retirees. So it's not that we're trying to kick you off the plan. It really is what is the best solution so we can have a sustainable benefit for our retirees, for all of you, and then for all of our active employees when they retire someday. So again, looking at what is the best option. You'll look at other state employers that are doing something different. They are putting retirees in a different plan that doesn't have as many options. So that's some of the things that we looked at. But again, we wanted our retirees to have as many options so you could get coverage that was best suited to your needs. And we're going to provide you a subsidy to pay for those, whatever you choose. Okay?
I'm the spouse.
At this point, the decision has been made, and yes, we're moving forward. Mm-hmm.
Okay, I'm the spouse of a deceased retiree.
Uh-huh.
And when my husband passed, I was told that in order to have the dental coverage, I also had to keep the medical coverage, because I also get insurance through the employer where I retired from. Is this still going to be the case?
I'm going to ask Corinne that. Yeah, no, you do not have to keep your medical insurance to continue your dental insurance.
Okay.
So that's how it is today. This change doesn't have anything to do with that. So you can continue dental, but the one thing you do want to keep in mind is that once you drop the medical coverage through USG, you cannot re-enroll. That's one of the rules that we have had in the past, and that will continue. So if at any time in the future, if you think you're going to lose that coverage through your other employer, you may want to stay under the USG healthcare benefit, because once you drop that benefit, you cannot re-enroll. But if you've already got other coverage and you want to drop this coverage, you can do that and keep the dental plan.
Okay, but would the advisor help me in terms of coordinating? Because basically right now, my other coverage pretty much paid everything.
Yeah, so, and I don't know what your other coverage is, so I'm sure you'll talk with
Well, I've
your
got Blue
benefit.
Cross Blue Shield with both of them.
Okay, but I guess just whether it's, yeah, they'll talk through what that coverage is and probably help you make that decision.
Sure, we can, yeah, we can definitely help with that. And you might find that, you know, on what you're paying on in both areas, if it's, you know, no cost to you, that's an easy decision to make, just keep both coverages. But certainly we can help you make that decision during that time frame, that, you know, October through December, absolutely.
Yes.
That's a nice problem to have. I wish I had two coverage.
I have sort of a similar question, but I'd like to clarify. If you have a retiree and a spouse that has been covered through USG for a very long time, and the retiree dies, what becomes of coverage for the spouse?
Just like it is today, that coverage for the spouse, is now a surviving spouse, that coverage will continue for his or her life, just like we have today.
Thank you.
Mhm.
Okay, sorry, she skipped you. She kind of skipped the order, I don't know.
Absolutely. Question is, just in case nobody could hear, the question is, when you talk to that benefit advisor, it sounds like, you know, maybe that conversation would involve, you know, some personal information, and maybe I don't want to talk about, you know, my illness or my medications. That is totally up to you. We'll work with whatever information you provide to us. If you say, you know, Brian, you seem like a great guy, I don't want to tell you about my medications or about, you know, what medical conditions I have, that is absolutely up to you. We'll work with the information we have. Absolutely, yes, ma'am. We follow as a you know, very large corporation, and working with employees and retirees is the work that we do. So absolutely, we have very, very tight security controls, you know, encrypted data information. The only thing that we transmit to the carriers is the basics they have to have for your enrollment. So it's typically your demographic information is typically what happens. Absolutely. Yes, ma'am. In fact, great question. In fact, every year, all employees, including myself, and I'm not a benefit advisor, but absolutely we go through all HIPAA training, security. We have very, very tight controls within Aon Hewitt. Yes, ma'am. No, ma'am, that's an option. You'll have a multitude of options with whatever carriers you choose. You can have it come out of your Social Security. You can write a check. You still can do that. You can have it come out of a bank draft. You can come out a credit card. Totally up to you. Totally up to you.
And I just want to let everybody know, we're going to take a few more questions, and then we're going to wrap it up. If you still have questions, we'll stick around and be happy to answer those for you.
I was, pardon, louder? Okay, I don't know. Okay, there it is. We will be paying Medicare Part B, and we'll be paying to whatever carrier we have. I know you don't know what the premium is now, or what the payment that Georgia State will, USG will come up with. But do you have any examples? Because it looks to me like we're obviously going to be paying a lot more for what we have, or cutting what we have.
And that's one thing that did come up in some other meetings, is that the retirees are thinking, okay, these premiums are going to be more because USG is making this change to save money, or because of costs and that type of thing. But actually, when you look at the premiums in the marketplace, because it's covering a larger number of retirees, you've got 30 million retirees out on the exchange, they're much more efficient. There's a lot of competition. Those carriers really want retirees to enroll in their plans. The premiums are actually lower than the same. Like if you look at the comprehensive care plan and look at that premium, which is around $400, when you take into account your cost and USG cost, when you look at a comparable plan out on the exchange, the premium is lower because of that, the volume and those efficiencies, and there's also some federal subsidies out there that we can take advantage of. So you're thinking that, oh, I'm going to be paying more out of pocket for the same coverage, and that we're not seeing that. When you look at what the premiums are today, 2015, the premiums are actually less for about the same type of coverage. And when I say, well, I'm not saying the exact same coverage is because there's not an exact plan out on the exchange like you have with USG today. So there might be a plan very similar. Today, the comprehensive care plan has a $500 deductible. So out on the exchange, there might be a plan with a $450 deductible. So it's going to be slightly different, and that's why I can't say it's the exact same coverage. But there's going to be a plan out there very similar than the coverage that you have today. Do you want to add anything to that, Brian?
I was just going to say generally, and thank you, if on average folks in that plan are paying about $400 in premium?
No, that's the total premium. They're paying about $116 a month for that coverage.
Yeah, you'll find I think most folks will be pleasantly surprised in the Medicare marketplace. Like I said, there are Medicare Advantage plans that are zero premium. Certainly you can find Medicare supplement plans where you could pay a little bit more than $116 a month, but I think in general, you'd find that absolutely you can find plans very similar and at price points very similar to what you're paying today, as well as even save some dollars. So I think, again, that's what's the nice thing about the individual market is there's so much choice out there, and as Karen mentioned, these carriers are competing against each other for your business, so they very much want to be as competitive as possible. So I think you certainly can find things in that range as far as very, very good medical coverage.
And again, USG will give you that contribution amount. We don't know what that amount is, but we'll give you those dollars, and then you'll be able to make the choice on what plan you want to enroll in.
Yes, I have a couple of questions. This advisor from Aon, is this a full-time employee in the United States, or is this contracted out and I'll get somebody from Sri Lanka?
Yes, sir. Thank you for saying that. Yes, they are all employees, full-time employees of Aon, and they all are based in the United States. So that's, you aren't going to have to worry about, folks speaking different languages or anything like that. They're all here and they're all full-time employees.
It doesn't have to be another language. They speak English a different way.
As long as Chicago English you can understand, or Houston, there's some of our call centers. I think you'll find you won't have any problems communicating. But if, just to make that point, if you don't feel like there's a good connection there, maybe it's a male and you'd feel comfortable with a female or vice versa, if you want to talk to somebody else, it's your decision who you work with. I mean, we're going to try to find you somebody, number one, that's licensed in your area because they know the plans really well and they're the experts there. But we have other experts that are working that area. So if you just say, gosh, I'm not, that Brian guy, he talks funny, I want to talk to somebody else, that's fine. That's your decision.
All right, I have another question. We're going to talk to this person for 90 minutes max on the phone, and they're going to have to learn all this stuff. Why don't you have people send in their information about surgeries and medications and everything, not wasting time repeating all that, hoping they can write it down and get it right?
Part of that is the lady had the good question about PHI and privacy. First of all, due to Medicare regulations, we aren't going to tell you that you have to tell us everything about you. That's totally up to you, first of all. So again, that information that we're going to get from USG about you is really basic demographic information, your name, your address, just so we know who you are, your phone number, those types of things.
Talking to the right person.
And that's really that part is that's up to each individual, as much or as little as you want to share. Again, surgeries you've had, things like that, doesn't really have a lot to do with necessarily the plan that you're going to be in, but what we do is we have some tools that really kind of help you decide what plan might be right for you as far as like premium versus, out-of-pocket costs and those types of things. So we really try to stay out of, if you want to give us your history, that's great, and obviously we keep that private, but that's totally up to you. So we really don't ask employers to give us that kind of private information.
All right, the third thing, these policies written by various companies are not going to just be Medigap companies. They're restricted by the state, which ones can be sold in that particular state. So this is something in addition to that, maybe including some of that. I think there's 6 that are allowed in Georgia.
Right. And that may well be, but exactly, any carriers, the only ones that will represent, number one, we have to have a contract with the carrier, but obviously that carrier has to be approved in your state, in Georgia, for example, as well as Medicare Advantage plans and prescription drug plans. So absolutely, number one, they have to be state approved or Medicare approved, and then our advisors would actually be contracted with that carrier.
But not all Medigap plans are sold in every state.
That's correct.
So they have to be approved for that particular plans.
Yes, sir. Yeah, we can't do anything outside of Medicare or state regulations, so absolutely, they'd have to meet all the state requirements to even be offered in that state.
Okay,
That's correct. Yes, sir.
Yeah, and that was one of the things that we looked at already, as we looked at all across the country, where do USG retirees live? And actually, there's 3 states in the country where we do not have any USG retirees. Can you guess where that is? Alaska is one of them, Idaho, and North Dakota. So every other state, we have USG retirees. Why don't we go ahead and take one more question, and then, like I said, what, 2 more? 2 more questions? Okay, all right, go ahead.
Oh, one quick question. Excuse me, my sinuses. On the reimbursement, I want some clarification. USG pays the subsidy to Aon Hewitt. Aon Hewitt waits until we pay, and then you give us a reimbursement. Is a reimbursement into the policy for the next month? Is it a check? And it seems to be a 12-month accounting system that we'll have to check.
Right. I'm sorry, a 12-month accounting system, what?
Right. Is it going to be a 12-month accounting system? We have to check every month to make sure the reimbursement is done? If USG pays I take it that you're going to do 12 months, or are you going to pay every month? USG.
USG, it most likely it'll be one amount at the beginning of the year to cover you for the entire year, and then you can decide how you want to use those dollars, because as Brian said, there's going to be some plans that retirees may choose that have very little premium, but will have more out of pocket, and so you can use those dollars to pay for your premium, or if you have a zero premium or a very low premium, you'll have extra funds in that account that you can use for out-of-pocket medical expenses. So we'll give retirees that amount, and they can decide how to use those dollars. But I guess
and typically direct deposit is easiest and cleanest way that we could reimburse you, but that's, again, is up to you. We have options there as well.
So basically, we're going to have a 12-month coming in and going of various amounts, because probably you won't have an even amount every month.
Exactly. Yes.
So is there any way to get an accounting for your monthly and yearly, so that
Yes.
way you wouldn't have to play a guessing game that you were off 1 cent or 2 cents or 5 cents?
Absolutely. Yes, ma'am. We'll have both online and paper reports for your HRA, so we'll let you know both monthly, or you can go online anytime and see a true accounting, and obviously we're providing that back to USG. Obviously, it's USG dollars, so absolutely, you can see at any time what your HRA account looks like.
Thank you.
Yep.
Can we do one more question? He's been waiting for a while.
Okay, we'll do one more question, and then, like I said, we will all stay after and be here to answer any of your questions.
Thank you. Actually, I had 2 quick questions that
Okay.
are clarifications of earlier answers. One regarding pre-existing conditions. I wasn't really clear on your answer regarding some of the plans, there being potentially some underwriting depending upon the timing.
Right.
So to make it simple, are there plans that will be offered through this exchange that could potentially choose not to enroll someone because of a pre-existing condition?
No. When you leave your group plan, and come into the individual Medicare market, you have what's called a special enrollment period, and that's why y'all actually get to enroll longer than most folks in Medicare. It starts October 1 and runs through the end of December. As long as you enroll in that general time frame, there are no pre-existing or underwriting clauses for you.
And the second question has to do with prescription benefits, particularly for people who have chronic health conditions who are both dealing with significant prescription medication costs and also potentially having to see multiple specialists. So the plans that are going to have prescription coverage but also have the doctors that you need to see in that plan. Can you just speak a little bit more to the prescription benefit or the availability of prescription benefits overall for the plan?
Sure. First of all, the Part D or prescription drug market is, regulated by Medicare, so that benefit is there for Medicare beneficiaries. So the carriers, the prescription drug carriers, every year are bidding. Actually, right now they're working really hard because their bids are due in June for the next year. And what we'll do in that process when we're working with folks with their benefit advisor, if you're comfortable providing the medications you're on, our systems will actually do a check of all the formularies. So the list of drugs, that are covered are called formularies, or drug lists is essentially what they are. And depending on what types of medications you're on, they could be at different tier levels. You could be at a generic copay level and that. And what our system does that's really helpful is, so let's say I have 20 medications, not unusual. Some folks are on a lot of medications if they have, like you mentioned, maybe a chronic situation. What our system will do is it'll look through all the drug lists of all the plans that are available in your area, so we can make sure, number one, that all of your medications, first of all, are covered in some way. And then second of all, our system will also suggest if there's, let's say I'm taking all brand drugs, I just always have for whatever reason, our system will also say, there are generics available, and while we're not trying to be your doctor by any stretch of the imagination, but we could advise retirees in those situations that, Mr. Jones, there are generics that can really cut your cost down, and if you went to these generics, instead of a $50 copay, you might have a $5 copay or a $2 copay for a generic. So number one, we're going to go through and check and make sure that your drugs are on all those formularies or whatever plans we're considering. But then number two, we're also going to let you know what those copays are going to be, so you can help budget for that in that coming year, which is some real neat technology that we have. So you can say, not only is my premium going to be X per month or per year, but I can also see what my out-of-pocket cost might be under this plan with the medications I'm on, and depending on, things like how many times I go to the doctor. But to your point, sir, yeah, the prescription drugs is a very big point of emphasis for us, and we make very well sure that we collect that information. Again, it's your wanting to share that with us, because that really can help us make sure we get you into that right plan. Number one, that's going to cover your drugs, but number two is going to hopefully cover them for you in an economical manner. Does that answer the question? Okay.
All right, so I do want to thank everybody for attending today. I appreciate all the great questions. We are looking forward to seeing you all in September. Hopefully you'll be available to come to those meetings to get more information, and we'll have some more information in the mail to you in May. So thank you again.
Thanks so much.